Welcome to Chemo 101. I am the oncology pharmacy practitioner, and I will briefly review some details about chemotherapy treatment. Cancer treatment includes many different forms of treatment, of which chemo is a form. What treatment you receive is dependent on your type of cancer, what the results of diagnostic tests tells your oncologist about your cancer, and your own personal characteristics. In the next few slides, we will be addressing common questions about chemo treatment. Firstly, how does it work? Chemotherapy, or chemo for short, is a large group of drugs that work to kill or stop fast-dividing cells in your body. Cancer contains some of the fastest dividing cells in the body, which makes it very sensitive to the effects of chemo. Unfortunately, some of our normal, healthy tissues also contain fast-dividing cells, for example, your blood, your skin and hair, and your gut or digestive tract. As a result, chemo can affect these cells, which therefore causes side effects. How is chemo given? Your chemo will be given in cycles because the risk of damage to healthy cells limit the amount of chemo we can give at a time and how frequently we can give it. A cycle is made up of your treatment days and rest days. The rest period in between cycles allow the recovery of your healthy cells. Different types of chemo will have different cycle lengths. Some cycles are 2 weeks long and others are 3 weeks or 4 weeks long. Your oncologist will be able to tell you how many cycles he or she plans to give you and how long a cycle would be. What chemo medications will I receive? That is going to depend on many things. Different medications are used for different cancers. There are many regimens to choose from, and they can involve one drug or multiple drugs. The way a chemo medication or a group of chemo medications are put together, how they are scheduled, and when they are given is called a chemo regimen or protocol. Your oncologist would select the best treatment for you based on many factors, including the results from your tests and your own personal characteristics. Will I have side effects? Yes, most people will experience some side effects, but they're generally few or mild. What side effects you get will depend on the type of cancer you have, the medications used in your regimen, how frequently you are getting chemotherapy, the dose of chemotherapy given to you, and your body's individual and unique sensitivities and response to medication. Many people experience few or mild side effects, but while there are many types of chemo-related side effects, we can't predict which ones you will actually experience. Different people receiving the same chemo regimen as you can actually have completely different side effect experiences. As a result, you will be told of side effects you may be at risk for, but it is quite possible that you will not be experiencing them. When will I have side effects? Even though your chemo treatment may be given on one day, not all side effects come at that time, and they don't all come at once. Some side effects develop over time, while others improve in between cycles. To explain this graph that you see before you, the number line at the bottom of the screen represents the number of days after chemotherapy, marked by the red triangle. The next cycle of chemotherapy is given 28 days later in this example. The colored bars represent when the symptoms might start and when they usually end. For example, if nausea and vomiting affects you, it will likely start around the day of chemo and may last until the 5th day after chemo administration. Your immune system may become low or weaker, and you may develop mild sores and diarrhea, but they don't usually happen right away, occurring several days after you have received your treatment. They can also last for a fixed number of days and then recover. Hair loss, on the other hand, might begin quite a bit later, approximately 2 weeks later, and may persist throughout chemotherapy cycles. Fatigue, on the other hand, is something that might start at the beginning and might stay with you in varying degrees throughout your cycle. Talk to your cancer care team about what side effects are relevant to your regimen, and make sure you know what are preventative strategies that you need to start early, ideally the day that you start chemotherapy, in order to minimize your risk of getting these side effects. Do I have to avoid crowds? No. Try to live life as normally as possible, but do take good general precautions such as hand washing and avoid direct contact with people who might potentially be sick. Do I have to avoid being around my kids and grandkids? No. Chemotherapy is eliminated from the body through your body fluids for the first few days, such as in your urine, your stool, your large amounts of sweat, and large amounts of saliva. But you can pass it to people through your skin, and the amount in small amounts of body fluid is actually quite negligible. Therefore, touching, kissing, hugging will not expose your loved ones to chemotherapy. How will I pay for some of my medications? It is very likely that you will have to pick up prescription medications to be used for your chemo. If you are uncertain if you have medications to pick up, check with your cancer care team or the North York General Hospital outpatient pharmacy. Your cancer care team would have already made some predictions about whether there will be difficulties for you to pay for your medications. If there were any possibility of you having to pay high medication prescription costs, you would have been referred to a drug access facilitator. Our drug access facilitator is responsible for obtaining your medication history and will assess your medications for high costs and/or insurance coverage. Don't worry if you do not meet him yet. If necessary, the cancer care team will contact him or her at the time of your treatment. If necessary, the drug access facilitator can liaise with drug support programs to support you should you have medication costs that are outside of your ability to afford. Can I have alcohol, caffeine, or spicy foods? Yes, they are allowed in moderation. Alcohol is not recommended during the day of chemo and on the days that you are taking your anti-nausea medications. After those days, it is okay for women to drink up to 1 serving a day and for men to drink up to 2 servings per day. Caffeine is also okay in moderation, but coffees, teas, or other caffeinated products should not be the main source of fluids. Ensure you are drinking lots of non-caffeinated fluids to prevent dehydration. It is thought that good hydration in your body would help your body recover quicker from chemotherapy and minimizes side effects. Aim for approximately 8 cups a day. Can I eat spicy or acidic foods? Yes, spicy or acidic foods are generally okay to eat if you enjoy them and you don't find that they bother you. But do be careful to avoid them at times when you are having heartburn or indigestion, you are experiencing mouth sores or pain, or you are experiencing diarrhea. Spicy and acidic foods can aggravate these symptoms. Can I take supplements while I am on chemo? As chemopharmacists, we don't usually advise on the benefits of supplements. However, we can evaluate any of your supplements for potential risks. Some of the ones we would want you to be very cautious of would be supplements with antioxidant, antiplatelet, or probiotic properties. Antioxidants are not usually recommended with most chemotherapy medications. There is some evidence to show that they work against the way that chemotherapy works. Some of the most common antioxidants are vitamins A, vitamin C, vitamin E, and coenzyme Q10. Note that we are only concerned about the pill form and extract forms of antioxidants. It is okay to have foods of these products. Feel free to enjoy foods that are high in antioxidants, such as fruits and vegetables. We are not worried about excess absorption of antioxidants from food. We are only worried about the excess absorption from pills and liquids. Supplements with antiplatelet properties may increase your risk of bleeding while on chemo. Common supplements with antiplatelet properties includes fish oil, ginkgo, curcumin, turmeric, and garlic. If you like these products, enjoy them as food or as the spices. That would be okay. And please avoid the pill forms of probiotics. If you enjoy yogurt, probiotic yogurts are a good alternative. Probiotics are forms of weak bacteria. While they may have little risk in a person with a strong immune system, they can pose infection risks since you are going to be on chemotherapy. The pill form of probiotics tend to have significantly larger amounts of bacteria per pill, which is why it's okay to have yogurt forms of probiotic instead. We ask that you bring in the containers, pictures, or labels for any of the supplements and prescription medications that you are taking so that we can evaluate it on the day of your chemotherapy treatments. That way, we can ensure your medication profile is always up to date and that medication interactions are evaluated in a timely manner. We encourage you also to check for any new prescription medications that are ordered by your oncologist a few days before you're about to start chemo treatment. If prescriptions were not given to you specifically and you are due to start chemo within a week, please check with the North York General Hospital outpatient pharmacy on the ground floor. The North York General Hospital's Cancer Care Program has a number of chemotherapy pharmacists to support you. Please don't hesitate to call us if you have any medication or supplement related questions. We would be very happy to help address any questions or concerns that you have. Thank you.